Hi everyone, this is Nicole with Defray Personal Injury Show. I'm here with my guest, Jean-Paul Anderson, and we had the privilege today to interview Dr. Pranay Patel, who's an orthopedic spine surgeon.
Yes, welcome, doctor.
Thank you for having me. It's been great.
Yeah, absolutely. So we are going to be asking Dr. Patel a couple of orthopedic spine questions. He is an orthopedic surgeon. I believe your locations are in Newport Beach, if that's correct.
It's more Manhattan Beach.
Manhattan
Beach, Torrance, and then also in Century City and the Valley.
Century City and the
Wow,
Valley. So,
that's-
okay,
that's
San Fernando
amazing.
Valley for anybody who's out here.
Lots
right.
of traveling. That's good.
Definitely.
That must mean you're an amazing surgeon if you're traveling and moving around that much.
It's nice to get a good cross section of patients
Yes.
by having various
So,
locations.
tell us, how long have you been doing this, and what do you love about your profession?
So I've been doing surgery for 9 years. I've been in private practice for 4 now. And there's a lot of things I love about being a spine surgeon, orthopedic spine surgeon. I think probably the number one thing on the list is the immediate gratification that you can get with spine surgery. And I know it may seem contrary to what people think about spine surgery, but when you're dealing with nerves, when you're dealing with instability of the spine, and you fix it, patients tend to get better very quickly thereafter. And so it's that immediate gratification that drew me to spine surgery in the first place, and made me do my fellowship in spine surgery after orthopedics.
That
Wow.
must be amazing, to actually heal someone who's had nerve damage or had drop foot and just relieving that pressure off the nerve and having that come back, and then of course no pain anymore, which is an amazing feeling.
Let me ask you this other question now. What's the nicest thing one of your patients has ever done for you?
So I've lucky enough to have had some great patients. One patient literally cooks me something different every time. She knows that my family's out in Illinois, and so brisket one visit, cookies, holiday tray the next visit, so that's fantastic.
That's awesome.
At another patient, oddly asked me to take pictures of all her x-rays and then frame them for a pre-op and post-op, and
To show people?
to show, and then had like a
Case
huge
study.
heart around the post-op images about her spine being straight.
Wow.
And then another one knitted me a huge blanket, and while it's not probably the most aesthetically pleasing, it is on my patio.
So what inspired you to become a physician? Was there something that happened to you in your youth, family? What inspired you?
There wasn't one particular incident or injury that I can really point to, but I've always been drawn to math and science, and particularly science and human physiology. And then my family is in the sciences. Both my siblings are physicians, and I'm the youngest of 3, and so that obviously has an impact in terms of how that's reflected. Being the youngest child. So it's just my clinical interests or just subjects interest growing up was probably the biggest thing, and then just that want to be able to help people.
Yeah.
I think it's probably after you get into that field, you realize how much you are helping people, and it becomes even a bigger aspect of it.
So I know there's different full disc replacement, there's fusions. Can you tell us the difference, and I guess depending on injury or age, what would be the difference between getting a fusion or a full disc replacement?
Sure. And so to kind of explain the kind of 3 columns of spine surgery, just to make it simple, spine surgeons are, we're one-trick ponies. We try to keep things simple. And so we decompress what needs to be decompressed, we stabilize what needs to be stabilized, and we correct deformity. So those are the 3 pillars of spine surgery. So if someone has a disc herniation but doesn't have any instability, then they're the patient that is likely to get a simple, 30 to 45 minute microdiscectomy. You take the pressure off the nerves, the nerve feels better, that weakness can come back. Now, if they have some sort of instability, they have a pars fracture, or they have what they call a slip disc or a spondylolisthesis, then they're the ones that go on to need some kind of fusion. Now, in between those two, if the disc has been very damaged and there's a loss of a significant portion of the disc height, then you start thinking about recreating their normal anatomy, and that can be done with either a disc replacement or a fusion. Now, and to answer your question more directly, the disc replacement versus the fusion, if they're unstable, meaning the slip disc, or they have any kind of fracture within the lumbar spine, then there'd be a better candidate for the fusion, whether that's from the front, from the side, or from the back. Now, if it's more nerve-related pain, and discogenic back pain, meaning the disc itself is completely shot, so to speak, then they could be a good candidate for a disc replacement. Now, I'm a big fan of motion preservation, whether it comes from the neck or the lumbar spine. So if the anatomy is amenable to it, I would always try to do some kind of replacement surgery so that you can go home.
Move.
Exactly. You can go home from your surgery with the same motion that you had or similar motion.
I was reading this article, and it basically was saying that if you've had an injury in the past and you go and you get MRIs, like, is there any way that sometimes an injury wouldn't show up on an MRI showing, especially with thoracic, is what I read on that article?
So it can. It may not completely show up on the MRI. With thoracic anatomy, there's a lot less room for error than compared to the lumbar anatomy. And so even smaller disc herniations and that sort of thing can cause increased pain or increased disability for the patient, and sometimes it's not as clear on the MRI. But if something is intrathecal or intradiscal, then it's going to probably show up on MRI, and then the injury could possibly be something more muscular related.
Okay. And for a neck injury, what type of evidence, or what type of, I guess, what would someone feel if they had a neck? Yeah, the side effects, I guess. What would be the side effects from like an actual neck injury? I want to kind of touch base on like the neck, the thoracic, and the lumbar.
Sure.
We could start with
So yeah, so if someone's been injured in a car accident and they're having certain feelings maybe in their fingers, just to kind of explain what to look out for.
Yeah. Sure. So I separate neck injuries into three main categories. One, just the soft tissue. You know, you tensed up during the accident. Your neck had a flexion and extension moment, and basically had a whiplash type injury. Those are soft tissue related. They can get better with chiropractic, physical therapy, and anti-inflammatories. Now, the second two are more when the disc has something happened to the disc itself. Your neck tenses up. The muscles didn't do their job, and the disc, which is one part of the stabilizing aspects of the neck, popped out off the back and herniated. In the right language. And so it can either herniate on the nerves or the spinal cord. The nerves is when you feel that tingling, when you feel like, oh man, I have a pain down one arm, I feel weakness in my bicep, that sort of thing. And then the second part, which is what is pressing the spinal cord itself, those are actually not as spoken about, but it's more concerning because the spinal cord, we all know people get spinal cord injuries and they're irreversible. Yeah. And those are more balance changes, dexterity changes, and so they're more subtle, and they can be painless, and that's the dangerous part.
Wow. And the lumbar?
And so lumbar, in terms of the spectrum, is kind of a similar type deal. Now, the spinal cord ends at L1, which a lot of listeners may not know. The spinal cord actually ends at L1. So what's from L1 to S1, which is most of the lumbar spine, is nerve roots. And so most of it is going to be pain, numbness, tingling, whether it's the front, back, or side of your thigh, down to the foot. It can be weakness. And then if it can be more back pain if there's something related to a lot of arthritis in the back, or a one-time injury where it causes a slip disc.
Interesting.
So out of upper and lower, what injuries come in most into your practice?
In my practice, it's a good blend. I think that I do have a younger base that tends to get more like soft, like herniated discs, both in the neck and the low back. And those, in all honesty, are some of the best things to treat as a spine surgeon. In the neck, patients do very, very well with cervical disc replacements, especially if they're younger, if the conservative treatment doesn't work out. And then same thing for the low back. You take that disc herniation off the nerve root, and the patients are back to doing most of that things that they want to do within a few weeks.
So I kind of want to know, like, what is the process after let's just say a lower lumbar disc replacement? What is the recovery time? What do you have to do for physical therapy? And then are there certain diets that you need to keep on to kind of help that recovery speed up the recovery?
Sure. So patients do very well after lumbar disc replacements because it's only going from the front. You don't have to put any screws or anything from the back, which sometimes fusions necessitate that. And patients, even though it may seem more intrusive when you go from the front because you're moving all the abdominal contents to the side, there's not as many nerve endings. You're not separating the muscle fibers, and so patients just recover faster.
I want to stop you right there. For all the women that are watching, where is that scar located? How big is it? And can it be hidden in a swimsuit is my biggest concern. And I guess all the women that are watching too. Because from the front, like if you're a guy, yeah, scars are cool. But if you're a woman, it's like, okay, where's the scar going to be at?
So you know the funny thing is, guys ask me more about scars than women.
Really?
Yeah, like how big is it going to be, doc? I'm like, all right. And then
Because they want it to look cool. Like, it's going to be like one of those.
No, they're concerned about it.
concerned.
How do I get it to not show up as much? And
okay.
girls rarely ask about it, but it is pretty small. It all matters on what vascular surgeon you use, and I tend to use one who I think is great in Los Angeles that has some of the smallest incisions around,
Okay.
and so very easily hidden.
Wow.
Does it go widthways or up and down?
Depend on the anatomy, and
Okay.
I don't tell him how to do it, so he just he chooses the width. And also depends on how many levels. So if it's just one level, he can make it a smaller incision from the side, versus if it's a multi-level.
Got it.
And have you had any robotic training or any type of surgery that you've used robotics? I know there's a couple of different companies out there that are getting bigger and bigger into robotics spine surgeries.
So I have been trained on the Globus robot.
Globus,
I think that there's a time and place for its use. It does help place hardware in a more concise location, when you're putting in screws and whatnot, especially if you do it in a minimally invasive fashion. That being said, I would say the far majority of spine surgeons are very comfortable not using robotics. It is just another tool in our
out of all the tools that you guys have. And have you, I'm sure you're in the world of orthopedic, right? So are there, like, in the next 5 or 10 years, have you heard of like any special lasers that are coming out that, I don't know, or any special pill that you take and it fixes everything?
It's like little nanobots that crawl your system and fix everything.
Let's hope not. I'd be out of a job then.
Be out of a job.
Unless I created it, I guess.
Well,
Take this pill with all these small nanobots, you'll get fixed.
I think unfortunately, I think we're pretty far away from, stem cells being the end-all be-all or being able to create new cartilage. I think that joint replacement surgeons will tell you first off, it'd be great if we could create new cartilage. The knees and the hips. How many people do we know, family members, parents that got knee and hip replacements?
Yeah,
a lot.
And it would be great if someone could create something where that's injected or, whatever. A procedure where you recreate the normal cartilage or recreate the disc. We're just not there yet.
Okay.
And nothing that I'm aware of, and I try to keep pretty my close tab on the new, up to date on the new technologies coming out. I think the biggest thing that's coming out is really how small we can make the incisions and to do the surgery.
Especially for the men.
Exactly right. For you men out there that care about the incision, but I think we tend to just make the incisions smaller and smaller, which helps us go from before I was even trained to do this stuff, patients were staying in the hospital for 3 to 5 days for a fusion. Now I'm sending them home the same day.
That's amazing.
And so
really
it's
cool.
different.
That's
So this
amazing.
is where we're getting back to like the healthiness. Like after any surgery, just it could range from fusions to disc replacements. There's like special physical therapy that you do, diets. That's what I wanted to go back to. Like if you're on a great healthy diet, avoid sugar, or if you eat a lot of sugar, tell me how that recovery is with the difference between a healthy person and a sugar eater type of person.
So I got to give thanks to my sister's a cardiologist, and she's very much into, it's just not just taking a pill to solve your hypertension or your blood sugar. It's what you put in your body on a day-to-day basis. And she's big into like an anti-inflammatory diet. Not saying you like taking ibuprofen every day, but let's say turmeric powder or something that keeps the inflammation in your body lower naturally. And that also includes sugar, because sugar does increase inflammation in the body. And so when someone's post-op, they're going to do physical therapy after 6 weeks and so on and so forth. But it's that day-to-day determination of the patient to say, hey, I'm going to keep the inflammation down in my body just naturally. Keep the sugars down, because after surgery, for the first few weeks, there's natural hormones in your body that respond to the stress of surgery that increases your blood sugar. And so then if you also have a high blood sugar diet, that's going to increase blood sugar in general in your body, and then you get you don't want to get diabetes after surgery or even temporary diabetes, and that can increase risk for infection. And so it's just it's a kind of a global endeavor to have a great outcome after surgery. Your diet, anti-inflammatory, low sugar, and then
it's important. Yeah. How do you prepare before surgery? Is there any traditional ways or methods, or how do you prepare?
Sure. Before surgery, I have kind of a checklist of things to do. Make sure that my staff has made sure that the patient is optimized for surgery in terms of medications, pre-op appointments, pre-op clearance, and that's more my staff side.
Okay.
For me, I review the images, make sure that I still agree with the plan that was made. Sometimes a week before, 2 weeks before, or sometimes months before, depending on the schedule of the patient, and kind of realign what I my goal for surgery and my goal for the outcome for the patient. And then during the surgery, it's really, I listen to music during the surgery. I listen to, it's either 80s or house music, tropical house music.
Ooh. If I'm knocked out, I would want you to be playing house music in the background.
Oh, really?
I do take requests sometimes, unless it's country. I don't take a country because this puts me in a not so quick mood.
So hobbies wise, what do you do as hobbies?
Sure. So probably my biggest hobby is traveling. I picked it up around my mid-20s, and now I've been to 60 countries,
Wow.
60 plus countries. I kind of stopped counting, and it's kind of my passion. Helping understanding different cultures, getting the different foods, and then it helps me recharge. So
Yeah,
that when
of
I
course.
can come back and get ready for the next X amount of months where I'm helping patients and
My
working.
question now is, have you been to Ecuador or anywhere in South America?
I have. So I have been to Ecuador. I've been to Peru, Brazil, Argentina, Uruguay.
Nice.
Oh,
Colombia.
wow.
What's your
Oh.
favorite one down there?
It depends on why I'm going,
Okay.
but Colombia's great.
Uh-huh.
Peru, I think, is the culinary capital of Latin America, and so their food is fantastic.
Yes.
If you like big cities like the New York of South America, then it's Buenos Aires,
Uh-huh.
and then of course Rio for Carnival.
It's amazing that you get to travel and however many locations that you work. Gosh, you must be constantly busy.
Do you do what is it called? Doctors for Borders?
Doctors Without Borders.
Doctors Without Borders.
So
You should look into something like
so
if you haven't.
Yeah,
You
so I
should,
have
especially.
spine surgery. Usually they need more like medical doctors. There are some
got
spine
it.
surgeries that are done, but I do more adult degenerative conditions. I do some stuff on kids, but a lot of the stuff that's done with Doctors Without Borders is like pediatric deformity.
Yeah.
These poor kids who have 100-degree scoliotic curves,
Yeah.
but they're way too expensive to be done there without our help. And so then our implant companies and our pediatric spine surgeons will go there and do major scoliosis surgeries. And while I was trained to do scoliosis surgeries, it's not my main clinical interest. But I do have plans on doing some type of medical work abroad, because I think that's going to be
Yeah,
the
that's
last,
awesome.
not last, but one of the main things that I kind of bridge to keep my clinical interest going abroad.
Wow. Interesting.
That's awesome. That's something I would do if I was,
And
Especially-
the last, especially with what?
Oh, with all the traveling, that's something
Oh
definitely.
my God,
I
yeah,
would-
we're due for traveling. Her and I, we need to go traveling for sure.
You guys have a trip coming up, correct?
Yeah, we do. We do. We can't
soon,
wait.
yeah.
Hopefully in the next couple of weeks, I think.
2 weeks.
2 weeks.
Okay.
She's counting the
Finally.
days.
Yeah.
Yeah.
Finally.
Absolutely.
It's been years.
It has been years, guys. Providing
Keep-
services.
Keep your wife and your host happy. Take them on vacation.
Yeah, exactly. Well, I think that does it for today. I really appreciate you coming.
Yeah. Thank you so
Yeah.
much for having me. I think it was great. I
Thank
Yeah.
you
appreciate
so
it.
much.
So-
Yeah, for sure.
Again, this is Dr. Pranay Patel. Thank you so much for being on our show. And don't forget to like, share, and follow our channel.
Yes. Thank you, guys.
Thanks, guys.
Have a good
Bye.
one. Bye-bye, guys.